Hi, I'm Noel and I'm here to talk about therapy. Hopefully I'm going to be of use to you and you'll find it informative and helpful. Interesting question of the first session. I think it happens before you actually attend. So my advice would be that you prep yourself and that you somehow define what that first session is. I'll tell you ideally what would happen, what I'd like to see happen and what I ask of my team is that you're given some sort of formal assessment, and I like it if it's a bit of paperwork that you can fill in and you can have as a record. An assessment or an initial session should be a service in and of its own right, if that doesn't sound a bit weird. I think for a lot of people, just getting some sense of what the issues are with a professional, giving a name to those issues and having some sense of what might help with those issues is in of itself a really helpful exercise to go through. And I know quite a few people who they have that exercise and that's enough for them. They go away and think about their lives and maybe they make some changes to their lifestyle and that's enough. They don't need any more professional help. So the first session for me ideally would be you having a conversation with a mental health professional, psychotherapist, doctor, whoever it is. And you complete some questions on who you are, describe the issues that you've been having, how long you've been having them, a little bit of background. There's an old belief that you have to sort of tell your therapist everything about your childhood. That's not true, but just some highlights about what you've experienced in life and what's relevant. Things like ACEs, adverse childhood experiences and so on. Record all of that and then have a conversation with that person about what is bothering you and why it's bothering you. And for that professional then to suggest possible help or treatments for those things that are bothering you. And for that all to be recorded in some way so that you then go away and think about it rather than go, yes, I want to work with you. Avoid that. Go away, have some time to decompress, have some time to think about it and think about what's been suggested to you and actually go away and do your own research. That's the idea. The idea is that all of this help should be what we call co-constructed. So you're as much a partner in the process as the professional.